Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Dr. Josh Sharfstein speaks to Dr. Ken Fox, the Chief Health Officer of Chicago Public Schools. Their topic? What else? Opening schools in the pandemic. Let's listen.
Dr. Fox, thank you so much for joining me to talk about the coronavirus pandemic and the Chicago Public Schools. Could we just start with your explaining what your job is in the Chicago Public Schools?
Sure thing, and thanks for inviting me. It's a delight to talk to you. So I am the Chief Health Officer of the Chicago Public Schools. Basically, you could think of it like this. I'm sort of like the district's pediatrician. I lead the Office of Student Health and Wellness. Our mission is to eliminate health-related barriers to learning and to promote child health equity in the city. That's what we're really aimed for. That's sort of our North Star. But in my role as a Chief Health Officer, I would say I'm principal advisor to the senior leadership at CPS on district health matters. And with my team, we develop and we oversee the health and wellness policies of the district.
And how long have you been in that role in Chicago?
I have been a little over 4 years, but I've been a pediatrician for over 3 decades. So this is the season to be the chief, and that's what I'm doing. Of course, I never imagined what I was getting myself into. But
well, I imagine that your time in the public schools can be divided into before the pandemic and after the pandemic.
Right.
And I wonder, that transition, as the pandemic was shutting down schools, what was your role as the Chief Health Officer? How were you thinking about the challenge, back in the spring?
This has been the challenge of my career, I have to say. Fortunately, just before this, I had gotten in a fabulous, sunny Mexican vacation in February. And I came back at the end of February, and I remember the dates because it was really it's such a before and after kind of thing. So I get into the office that Monday, the Monday following my return from vacation. And I think, oh yeah, I'm going to just go in early, get there, as I brought some gifts for my staff, just go pass those around, catch up on a few emails. But the second I sit down at my desk, which is right at State and Madison, which is a crossroads of the city, that's where we're located, I get this ring. It's the CEO's office. And I'm like, uh-oh, what's going on now? So, and before I could return it on my cell, I got a ring on my desk phone from the office saying, we are putting together our emergency management team to respond to COVID. I need you at noontime with your slides to talk about COVID and what you're going to do about it, or what we're going to do about it.
And from then, it's probably been 100 miles an hour.
That's right. I mean, it has been long hours, 7 days a week. I reflect on that vacation and just will look forward to when I have a chance to have another one, which doesn't really seem like anytime soon. But
so what have been the major health concerns that you've had over the course of this pandemic?
Right. So, I mean, we closed the schools. The schools were closed by the health department, the city's health department, in mid-March. And, we were in the same boat as basically most other schools across the globe. There's something like 1.5 billion kids whose schools were closed. at the start of this. And we know so much more now than we did then about kids and COVID in schools. But that's really where we started with the closure. And originally we were dealing with the most urgent emergency public health responses, trying to identify the cases quickly, get them into isolation, find out who the direct contacts were, and get them into quarantine, and then provide guidance to to everyone, because the schools, even though they were closed for students, they were still open for many other purposes. We were like a major source of meals for people in the city.
So you had a lot of just pure COVID management to do.
Absolutely. I mean, I was right there, with the team on the front line doing contact tracing.
Right.
We did it for months, and we built up some strong muscle in that regard.
What about the health effects of kids not being in school? Has that impacted your office and your work?
Yes, and it's a terrible source of anxiety and pain and grief, really. I mean, everybody's been traumatized, including kids. I mean, this is a huge challenge for kids in every way. Of course, they're the group least likely to acquire the infection, right, or suffer consequences of it, or to transmit it, but they are deeply impacted. When they don't have easy access to normal school, in-person learning, they suffer. And, one thing that has really become so evident, I think, through all of this is, the many contributions that schools make to the health and wellness of children. So far beyond just the educational issues, which are themselves huge. All right, you also have all the social and emotional, that's where kids play. It's where they learn to play. Mm-hmm. All right, it's a source of meals. It's a source of support. There are eyes watching out for kids, and so there's these child protection issues that are achieved in schools normally.
So what were you able to do to deal with some of those things during the shutdown? I mean, how does your job change if you're trying to help these other aspects as well?
Right. Well, I think the first thing that we contributed was to try to keep, the schools open for essential work. So that meant dealing with contact tracing among the population there in the school. So the nutrition support staff and security and facilities and the administrators who needed to be there in order to accomplish this essential work. But beyond that, basically teachers in the district and the leadership of the district had to figure out quickly how to do remote learning, and also, by the way, how to address the digital divide, right? So this was something that people were aware of for many years and struggled with over the long term. But it became a really acute issue when we had to suddenly shift from in-person to remote learning. So getting the devices out, that was another, and we did that through the schools, right? We did that through schools, even though students weren't there. We made all kinds of arrangements to make that happen. We got to get out. I mean, the scale of it was huge. So like 130,000 devices plus hotspots. And also, I mean, this is really the work of an amazing senior leadership team, but working with philanthropy and the city to arrange for greater access to broadband coverage, right? That's not, that's definitely not in the domain of a chief health officer, but it's clearly part of the work of the CPS leadership team. And so getting all that stuff up and keeping the schools safe enough so that all these kinds of distribution could happen was a big part of the work.
Got it. So now you're thinking of bringing kids back. How do you, as the chief health officer, put the pieces of the puzzle together for that decision?
Right. So I would say that we do this based on, all the things that have been learned, this accumulation of a quick accumulation of scientific knowledge over these past months about what's required in order to open schools safely, reopen schools safely for in-person learning. And can you even really do that? Yeah, the answer is yes. And the way that you do it is by building in these different layers of protection, these mitigation strategies so that you can do it safely. Now, there's a wide range to these. Obviously, there are they're the simplest, key ones, cloth face coverings for everybody, right? Social distancing, hand hygiene and respiratory etiquette and cleaning and disinfection and, of course, contact tracing. But even beyond that, we've had to build all these systems to do all these other things that are part of those different layers. So daily risk and symptom screening of anybody who comes into a CPS building. This is something that, we had to make it up to build it so that you could do this on your phone or your tablet or computer, and you ask, you answer a quick series of questions. I think it's like 6 questions. And the screener gives you a green or a red. Green means you can enter the building. Red means no. You fail the screener, and then we give guidance based on that. But so daily screener and the temperature checks. We talked about other strategies, cloth face coverings and hand hygiene, social distancing, and also the way that we organize kids and staff in the school into these pods. So there are small fixed groups of about 15 students and a teacher. And we maintain the integrity of the pods so that there's not mixing and mingling of kids as they normally would into school. Plus, all the cleaning and disinfecting and the mechanical ventilation. We had to investigate, really audit every single school in the district to make sure that the mechanical ventilation systems are right.
So you're basically reshaping the whole school environment.
Absolutely.
Around this. And
absolutely.
Even with that, there are some parents who may be nervous. And so may be worried that if their children get sick, they'll bring it home, and there may be a grandparent at home or someone with a chronic illness. And, how have you talked to those concerns?
Right. So we do this in many different ways. We just want to make sure that everybody has equal access to the best of what is known about this topic. And we teach people, or try to teach people, and talk with them about the many different layers. Mm-hmm. That, it's not just one thing that you do that keeps safe, but if you stack them all one against the other, you build yourself a good shell of protection. And so we try to get that message out through many different means. Our website, we do all kinds of public, town halls. We have a whole part of Chicago Public Schools that is really about family and community engagement. And that work has been, exploding.
So do you have a sense how many families might opt out? Are you giving families the chance to opt out?
Right. Yeah. So, whether people show up in person or coming in person or not, this is a voluntary thing.
Right.
So we survey them so that we get a sense of who's ready to come back. And right now, we've brought back pre-K students and students in moderate to intense cluster programs, sort of special ed type programs. They've been back a couple of weeks already. But our plan is to have everyone K through 8 back on February 1st.
Got it. And do you have a sense of how many?
How many? Yes, how many? So about 77,000 students we're planning to have back now. Our total, everybody, including high schoolers, we're 341,000 students in the district. But if you exclude high school, really you're talking about an eligible pool of about, 240,000 or so.
I see.
So we're somewhere around a third, which is a lot like a lot of other major urban school districts. So, I do think that as we build and can share and show how safe it is, it's one thing to talk about it.
Mm-hmm.
But as people see that you can actually do this, I think more will opt in.
Right.
Now, the other great fortune we have in Chicago, in a sense, is that there are tens of thousands of students who've already been back for months. Those are students in private and parochial schools. Something like near 140 schools of those schools have been open, tens of thousands of students, as well as all the kids who've been back in something like 3,000 daycares in the Chicago area. They've been back since June.
I see.
Right. So we're late, getting our kids back. It has been a struggle, and it continues to be. But I think as people see in those other kinds of systems that you can do this safely and operate when you have the mitigation strategies in place, as we share what our plans are, and as our kids do come back, people will be more inclined to get on board. And I really hope that's true, because, societies where kids do not go to school, those societies fail. And when kids miss out on all the benefits of school, the educational ones and the others, like the ones we were talking about, right? They suffer. And for me, I don't want people suffering. If they don't have to, they don't have to suffer. They can do this. We can do it in Chicago public schools, just as private and parochial schools have done, just as schools all over the globe have done. There's a UNICEF report that says over 1 billion kids are back now. They 1.5 billion were out at the start of it, but 1 billion kids are back, and we want ours included in that group of those who are back for in-person learning.
Got it. Well, I know that there, is an ongoing dialogue with teachers about this whole plan. I just wonder if there's anything that you would say if a teacher were just nervous about coming back in this.
Right. Being nervous, it's so understandable. Everybody's nervous. But we're all in this together, and we all love kids. That's why we're doing this. That's why they do what they do, and that's why we do what we do. And we want everybody to be safe, kids and adults. And it seems quite clear now that can happen. That can happen for all of us. It can happen safely. We're not being the pioneers here. Mm-hmm. We can look and see, well, what have others done successfully, and really take those lessons to heart and make those insights work for us too.
Got it. Well, thank you so much, Dr. Fox. This has been a terrific chance to catch up and hear how it's going in Chicago.
Hey, it's been my pleasure, Dr. Sharfstein. Thank you so much.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.